You are the inventor of the multi-purpose catheter, and you kind of arm-twisted your fellows, among them myself, to practice this multi-purpose catheter rather than using the more easy Judkins catheters. This tremendously helped us to manipulate catheters in the sinus of Valsalva, and this became particularly important when it came to manipulate guiding catheters for PCI.
So it was 38 years ago that I first met Andreas Grunzig. He was showing his poster, which still hangs in my office. This small start for interventional cardiology has spread throughout the world, and now the predominant treatment for coronary artery disease that's advanced is interventional cardiology, not surgery.
He's the person who attracted Andreas Grunzig in Atlanta, and then there was this wonderful course in Atlanta. Of course, the critical time in his life when he lost his colleague and friend Andreas Grunzig in September '85, but then he pursued the legacy of Andreas Grunzig in a wonderful way, and put really Atlanta on the map of interventional cardiology forever.
Spencer's been a driving force in invasive cardiology, and then in interventional cardiology, and then in all aspects of cardiology. He has been president of the American College of Cardiology. He was head of the Interventional Cardiology Board Examination Writing Committee that I served with him on. He has been editor of JACC Intervention, so he has done it all. He's been a huge individual in the field. He has been incredibly productive. He's prolific in terms of giving talks, in terms of relating to people.
I do read JACC Intervention from time to time. You are the editor-in-chief of that, and I noted on your editorial comment recently that you're sitting in your home in the Appalachian Mountains in the middle of snow reviewing papers, so I congratulate you for that.
We are all grateful to you for the time and trouble you have taken to preserve the history of angioplasty. You have managed to acquire and personally preserve paraphernalia, records, and images of an important time in the history of cardiology.
Spencer has been a special mentor to me. Obviously, we all know that Spencer is a giant in coronary angioplasty and has taught hundreds of thousands of interventionalists throughout the world. I was fortunate enough to succeed Spencer as the second chair of this committee, and I applied what I learned from Spencer in really trying to achieve balance and achieve consensus, and really sort of learned from how Spencer could run this committee and trying to apply to my role.
He never took anything for granted, and he always critiqued whether it was papers, ideas, etc. But he was very supportive, and he was willing to be cautiously optimistic with your ideas as long as you deliver the results. For me, Spencer is responsible to the academic knowledge, to the clinical training, and also as a mentor, he taught me how to bring that or move that to the next generation. So his legacy will always continue through the generation that I had the fortune to train.
I really must congratulate you and thank you for all that you've done for interventional cardiology, from being there at the beginning to helping us make this the subspecialty it is. You've really truly served as a global ambassador for interventional cardiology around the world, and you meant so much to me personally in terms of being a role model and really an inspiration for everything I've tried to accomplish.
That number one, he was incredibly involved with the American College of Cardiology. Number two, he was incredibly involved with the people around him and with his family around him. Number three, that really identifies the multiple facets to Dr. Spencer King. A great individual, a tireless worker, in the field of interventional cardiology, in the field of education, in the field of science, in the field of research. Tremendous individual, a tremendous friend.
You know, some would say that all philosophy is divided into those who are optimists and those who are pessimists. I choose to be an optimist. I think the outlook for the world is not doom and gloom. I think the outlook for our ability to provide health care to all our citizens is there, and it's our responsibility to do that. I think we're in the technical field. We're in a field of rapid advances in technical innovations. And I think in addition to that, we need to be responsible and find ways to deliver that technology to all our patients.